You're from Calabos. The only boss. With oneness. Baby, I will be everywhere I day and everywhere they go. TAPTAP Send got me covered. Therefore, if you need to send money or transfer money from Europe, from Canada, from USA, from UK, any part in Europe, you can send it through TAPTAP Send. And guess what? Oceania, they will receive it right here in Ghana and many countries across Africa. So what are you waiting for? Download TAPTAP Send now on Google Play Store or App Store. When you download, it's so easy to use. Tell your families, tell your loved ones to download TAPTAP Send. Okay? But also, when I receive my money, the other time I would channel, like my view, hey, you crazy.
Download TAPTAP Send now on Google Play and App Store. TAPTAP Send. It's secure, convenient, easy, and fast.
Buy an interest-free home and pay within 36 months. Yes, Daimler Homes' new gold standard development, Kilton Court, has just commenced, and you can own a unit now and pay within 36 months without any interest. Starting at 95,000, you can own an elegant apartment. And guess what? Discounts are available from now till end of May. To learn more, visit our website at daimlerhomesgh.com or call us on 0200-584-558. Daimler Homes, the elegance of living.
Hello, everyone, and good evening, and welcome to the Health Talk with Oasis. My name is Abena, and today my co-host is Dr. Akosua, and she's at work again. And today she is not the co-host. I will be co-hosting with Dr. Kojo.
Hi.
Hello. And so we are hosting Dr. Akosua today. Lovely red hair, still in the spirit of Valentine's, of course, who is going to talk to us about hepatitis. Because last week we had loads of questions and a lot of interest sparked on hepatitis. Dr. Akosua is going to talk to us through the different ones and how to protect ourselves. So without further ado, just to say, a lovely welcome to everybody who's joined, and thank you to all who joined and our faithful watchers, our constant watchers, those who join us week in, week out. Also want to give a shout out for Facebook and YouTube. We have not forgotten about you guys, because sometimes we tend to be bad with that, but we haven't. And this show was brought to you by TAPTAP Send. So please download, like, share, enjoy. Now, Dr. Akosua looks like she's ready to go off, so please go off.
I'm just trying to see. Hold on. Am I on mute? No, I'm not. Yeah, I'm just trying to see if I can share my screen. So, host, please help me share my screen.
Sure.
Yeah, it says only host. Okay, so hi everybody. We're going to talk about hepatitis today. We spoke about liver disease last time. Hepatitis is basically another form of liver disease. I said, and again, I'll probably keep saying this for a very long time, but just to help people understand a bit of medical terminology. Anytime you hear titis at the end of something, it just means inflammation, mostly. Not all the time, but most of the time. So if you hear things like laryngitis, it just means inflammation of your larynx, which is sort of your throat. Esophagitis, gingivitis, there's so many vitis, meningitis, it's all inflammation of. So if you talk about hepatitis, it's inflammation of your liver. And the word for liver in medicine is hepa something. So, we're just going to talk about how the liver becomes inflamed. Today we're going to focus on viral hepatitis, which just means that the cause of the liver inflammation is your viruses. Is somebody still? Oh yes, I can share it now. There you go. I think me if I'm sharing the right thing, okay? Can you see my screen?
Yes.
Can you see the screen I've got? Can you see the slides?
Yeah.
Yes.
Okay, cool. I don't know how it comes up. So again, because I'm using my phone, I actually forgot my laptop, which is not great. But so yeah, I'm going to share my phone. Right. So yeah. So we're going to talk about viral hepatitis, which just means that the cause of the inflammation of the liver is from viruses. There are other causes as well, as you can see on the introductory slide, which says things like your dengue virus, rubella, mumps, measles. There are other diseases that can cause hepatitis. There's actually bacterial hepatitis as well. There's autoimmune hepatitis, which just means your body fighting against your own liver. And then there's alcoholic hepatitis, meaning that the alcohol is the cause of the hepatitis. So I'll probably focus on the viral hepatitis and alcoholic hepatitis today, if time allows. So can you tell me what screen you can see now? Can you see the table?
Yes, we can.
Okay, fine. What do you see one slide at a time, or do you see all of them?
So it's about 2 slides. So if you could scroll a bit down, I think down.
Yeah, no, but you can see the table, right?
Can see the table and can see the other slide after it. Oh.
No, hold on. No, I'm just gonna. I think I'm gonna do something that might make it easier. If I do it this way, can you then see one slide at a time?
Yes.
Is that better? Yeah. Okay, fine. So this is just a table to talk about there. So there are 6 types of viral hepatitis. So there's your hepatitis A, B, C.
Just to let you know, I don't think we can see the whole screen. If you can zoom out a little bit, maybe.
Oh, sorry. Oh dear. What can you see now? I've totally lost it.
You can just present it this way if it makes it easier. That's fine.
Can you see the slides now? Can you see it?
Yes.
Is that better? Yeah. Okay. Yeah. So basically, they used to say there was 5 types of hepatitis, which is basically your Hep A, Hep B, Hep C, Hep D, and Hep E. But apparently, there's now a Hep G as well. But I'm not going to go through hepatitis G because God, I only found out about it today when I was researching this. So I'm not going to go through it. But just this table shows you the difference between, so the HAV just is hepatitis A virus, HBV is hepatitis B virus, and so on and so forth. And the table just shows you that the Hep A is the most common, the Hep B is the second most common, and then C, D, and E are not very common. The part where it says the routes of transmission is basically how do you get it. So hepatitis A, you get through the fecal oral. What that means is you get through ingesting it, so eating, and most bodily fluids as well. So the fecal just means through the toilet, but obviously nobody eats anybody's toilet. So it's usually meant, it usually means sort of hygienic. So if you go to the toilet, you don't wash your hands, you touch a doorknob, you go away, somebody else comes, touches a doorknob, they take that, then they use their mouth, they pick up a packet of crisps and start eating it, then that virus can be passed on. That's why we say it's the fecal oral route. Again, I'll come back on how to sort of prevent that. Hepatitis B is usually through sexual intercourse, so it's actually known as a sexually transmitted infection, but it can also be passed on from mother to daughter, especially if a mother is pregnant and has hepatitis B, then they can pass that on to their child. Hepatitis C is also it's very similar to hepatitis B. It's also through sexual route and mother sort of maternally passed on. Hepatitis D is also sexually and parentally. And then hepatitis E is the fecal oral route. So if you look at this table, there's 2 forms of passing on the viruses, through sexual or maternal, or through eating and stools. So that's the 2 separate ways. The table also shows incubation periods and things, but there's no need. That's not very important for today's purposes. Where I want you to look at is where where it says chronicity. So that's 1, 2, 3, 4, 5, 6, 7. The 7th row down, where it shows you. So the chronicity just means how chronic is it. Hepatitis A is usually not chronic. What that just means is it doesn't usually stay longer than 6 months. You only get it for it's acute. So you get infected with it, with the virus, and by 6 months' time, it's gone, it's dealt with. Hepatitis B and the rest of them can be chronic. And then if you look, it says cirrhosis and HCC. So HCC is a type of liver cancer. So hepatitis B, C, and C can increase your risk of getting what we call liver cirrhosis, which I spoke about last week, and that's just basically when your liver dies. And then it also is an increased risk of getting liver cancer if you've ever had hepatitis B or hepatitis C. So something to sort of keep in mind. So that's just another table that I wanted to look at. The next slide shows you the diagnosis, the treatment, and if there's a vaccine. So again, I'm going to concentrate on the vaccine because the diagnosis and treatment, I'm going to go in a lot more depth. So I'm not going to discuss that now. But hepatitis A and B have a vaccine. Hepatitis D also has a vaccine. Hepatitis C doesn't have a vaccine yet, and hepatitis E, not really. It's been developed, but it's not in use yet as of the last time that I checked. So there you go. How do you get hepatitis? So etiology just means what? Etiology just means like how do you get the infection? So I think I've already talked about hepatitis A, but let's talk about. I'm going to go into pathophysiology here, which is basically how the virus affects your liver. So regardless of whether it's hepatitis A, B, C, or D, they all work in a very similar way. The virus gets into the blood. Then it travels to your liver. For some reason, it's attracted to the liver. When it gets to the liver, it enters your liver and it produces an antibody. Yes, an antibody, which is basically a type of protein. That protein, basically, then your liver eats up that protein and then it projects it on top of its cells. This is, I don't know how best to explain this, but basically, if you think about your liver, that picture that you can see there, that's your liver. The protein that's produced by the virus, your liver basically just presents it. So if you think of a hand holding up a liver, a protein to say, here, there's this protein inside of me. And this is usually what the body does to fight infections. So when you get an infection in your body would usually get a hand and then hold up the infection and basically say to the rest of the body, hey guys, I've got an infection, please come and save me. So that's what the liver does. It presents the protein on top of the liver and says, I've got this virus inside of me, please come and save me. Because your liver has done that, your white blood cells will rush to your liver, basically trying to save your liver. And what they will do is the white blood cells are basically the army of the body. So what they will do is they will try to kill the virus. In doing so, they will be, and again, I said this last week, when your body starts to fight an infection, as much as it fights, you think of the place as a battleground. So your liver becomes a battleground where your white cells are fighting against this virus. But every battleground gets damaged. So this is how your liver ends up getting damaged. Your white cells are doing such a great job protecting your body against the hepatitis virus, but in doing so, they're also damaging the liver cells. And that's how come your liver ends up being inflamed. So that's what happens. What kind of symptoms are you going to get from this? You basically, again, I'm just scrolling through to here. So the kind of symptoms that you get are things like anything that you get liver disease. So you can get jaundice, you can get abdominal pain, you can get a bit of nausea, vomiting. It's very non-specific symptoms, but a lot of time you get a lot of tiredness. You might end up getting blood clots because your body's not making enough, clotting agents. So, but the thing that most people will present to their GP with is things like, oh, doctor, I'm feeling very, very tired. I've got some tummy pain. I've got a bit of nausea, vomiting, or jaundice. So these are the type of things that people will present with to the GP. So I'm just trying to look for the slide on symptoms, but I don't seem to have any. Anyway, so that's the kind of symptoms that usually they'll present with when it comes to the GP. When you present with such non-specific symptoms, the GP has to think, or the doctor has to think about what's going on and think, oh, what could this be? So I've got the slide up that says differential diagnoses. So the kind of symptoms that you present with, these are all the things the doctor will be thinking in their head. But in order for the doctor to find out, is this malaria? Is this dengue fever? Is this liver disease? Is this gallstones, which is cholangitis? Is this something else? They're going to do a blood test. So they'll do a liver blood test. And when they do that, your liver enzymes will be elevated. And whenever your liver enzymes are elevated, then they might think, oh, could this be an infection? So they would then go on and do something called a hepatitis serology, which would then screen for hepatitis A, B, D, E, C, G, or all the rest. Okay, so that's the kind of thing. So this is again the approach to the diagnosis. We do a blood test elevated. We say, okay, we need to look for hepatitis or other things like there's another virus called CMV, which sometimes causes hepatitis as well. In alcoholic hepatitis, it's a similar thing that happens where your body basically your liver gets damaged by the alcohol. And again, I spoke about this last week, so I'm not going to go into details of it, but it's a very similar thing that happens, but you drink too much alcohol. Alcohol causes your liver damage, and by the liver being damaged, it just causes inflammation of the liver. And the symptoms that you get is very similar to what you get in hepatitis virus as well. So again, abdominal pain, vomiting, sometimes you can get jaundice from it. The only difference that we're able to tell from if we do the blood test that we're able to tell that this is viral and this is alcoholic. There's a specific liver enzyme that is more elevated in alcoholic hepatitis than it is in viral hepatitis. But even still, even if we're wondering if it's alcoholic hepatitis, we'll still do the viral screen. If all your viral tests come back and is negative for all the viruses, but we know you've got hepatitis, then it's pretty much likely to have alcohol. And obviously, we usually take an alcoholic history as well. A lot of the time, people don't tell us very straightforward. If people drink 14 units of alcohol, they might say, "Oh, doctor, I'm only drinking 7." But a lot of the time, we can tell from the blood tests. It will be if the history doesn't match the picture, we're usually able to tell, okay, maybe they're drinking more than they're telling us they're drinking. How do you manage hepatitis? So a lot of the time, there's, again, hepatitis A, B, C, D, E, they're all managed in similar ways, but also with very subtle differences. So hepatitis A, usually we don't do much. Like I said, it's not a very, I don't want to say it's not a very dangerous one, but it's one it's quite common, but again, it doesn't really have lasting effects. It just hangs around for about 6 months, and then, or less than that. I mean, the longest it'll hang around is 6 months, but a lot of the time it's gone in about a month or two. We don't give any medication for it. It's usually just drinking lots of fluids, a bit like when you get the cold, just managing your health, and that's pretty much it. We do keep an eye on you, so we will call you back in about 2 weeks' time to do another blood test to make sure that your liver is not going in the wrong direction, that your liver function is actually improving. And so, yeah, it's usually the supportive management that we would use for hepatitis A. There's also vaccines for hepatitis A. So a lot of the time, if you've got an hepatitis A, sometimes we can offer it to your family if we feel like they're higher risk of it. If you're traveling to places which have a high incidence of hepatitis A, places like Asia, so Pakistan, India, those kind of places, then we tend to offer vaccinations for it. Oh, that was hepatitis B, wasn't it? Yeah. Okay, so we move on to hepatitis. So that was hepatitis A. That was talking about the vaccines. You've also got a vaccine for hepatitis B. Again, very similar things. If you're a mother who's got hepatitis B and you're pregnant, you will be offered a hepatitis B vaccine. And that's because sometimes that can be protective against sort of the unborn child. And then we give them to little kids as well, because I think in the UK, they are given routinely to little kids. Because hepatitis B is probably the most dangerous hepatitis one out there, we tend to sometimes treat with something called an immunoglobulin. So depending on if you're immunocompromised, if you've got really bad symptoms from it, again, if you're pregnant, we might treat, and if you're pregnant and have active hepatitis B infection, then we might give you these hepatitis B immunoglobulins. There are other slides here that I don't really want to touch on, but the one thing I want to touch on is this prevention of it. So when we talked about the fecal oral route and the sexually transmitted route. So I'm going to lump the fecal oral routes together, which was basically the hepatitis A and hepatitis E. So you can get these from contaminated water, contaminated food, and again, like I said, if you're not being very hygienic. So the way to prevent it is just basically being hygienic, like, even if you don't have hepatitis A or E, you just need to be a bit more careful. If you live with, like, a lot of people who live in student accommodations, or if you live with other people, even if it's your family members, you don't always know what other people have, like, unless it's your husband or your children. Let's say you're living with, I don't know, your in-laws or something, you might not necessarily know your in-laws' medical history. So it's just good to keep sort of a good hygiene. If you go to the toilet, if you touch like the toilet doorknob, or actually, at any time before you eat anything, you should really wash your hands so that you're making sure you're not transmitting this thing to you. Try not to share spoons and towels with other people, even if it's your husband or your child, because again, they can be passed through that sort of route. There is a vaccination, as I said, and there's an immunoglobulin to treat. For the sexually transmitted ones, again, we cannot stress on this as much. You might, even if you're on contraceptive pills or whatever you're on, a condom is the safest way to stop sexually transmitted infections. A lot of people think when we advise them to wear condoms, they think people will say to me, "Oh, but doctor, I'm on the contraceptive pill." Yeah, fine, but that the contraceptive pill stops you from getting pregnant. It doesn't stop you from getting an STI. So if somebody's got and the thing is, hepatitis B, and again, I'm going to come and talk a bit more about hepatitis B after this. Hepatitis B, a lot of people can have it and not actually know they have it. That's number one. And they can have it and it can lie dormant, but sometimes it can also be reactivated. So somebody might have it and you might not know that they have it, and they might not show any symptoms that they've got it. That doesn't mean they don't have it. And if you go to sleep with someone and you don't know what kind of history they have and you're not protecting yourself, then obviously you're exposing yourself not just to hepatitis, but to other very serious conditions out there: chlamydia, gonorrhea, syphilis. So you just need to be HIV. So you need to be careful when sort of dealing in sexual intercourse. Okay, I think I'm going to leave it there. Oh, another thing. Dr. Kajuri might be able to help me with this one. There's hepatitis C can also be, I think hepatitis C and B can also be gotten through sort of needle sticks, so bloodborne. So things like healthcare professionals were always told that obviously if you're taking blood from people and if you stick yourself with a needle, then you need to go and get the immunoglobulin. Also, if you're taking drugs, which obviously we don't advise, but if you are taking drugs, it is important that you don't share needles, that you're using a different needle anytime that you're doing it, because sharing needles, a lot of people who do drugs, especially cocaine and stuff, and they inject it through their veins, tend to end up getting hepatitis. Again, because in sharing the needles, you're actually passing on. And again, it's not just hepatitis, it's other bloodborne things like HIV. You're at risk of getting things like that. So again, you need to be careful. Obviously, I'm not encouraging drugs taken, but if you are doing it, you need to do it safely. I wanted to talk a bit more about hepatitis B, just because I think it's probably the most common amongst. Hello. Just because it's probably the most common amongst sort of within the African. Hello, can you guys see me? Oh, you can. Okay, yeah. It's probably the most common within the African community, and not actually just one. I think hepatitis A is common because it's easy to get. But if you think about hepatitis B, it's very common within sort of the people. If you're of childbearing age, like people who are having sex, and again within sort of the African communities or sort of the ethnic communities, and this is because of sort of the culture of the ethnic communities, of sort of the way that we share things, and the way that we can, because, and I was saying this last week, that a lot of the time, like, it's funny because you can go to a chop bar and two strangers can literally meet and start eating from the same bowl, in a chop bar and stuff. And as nice as that is, and as nice as community oriented as that is, sometimes you can be more prone to sharing diseases that way. Also, another reason I want to talk about it more is because of the uniqueness of. I actually really like the hepatitis virus because I think it's such. It's such a smart virus. And Dr. Good is looking at me like, what is wrong with this person? But the reason I think it's so smart is because I always imagine it as like an army, right? So hepatitis B virus is you've got a supervirus, which is the hepatitis B surface antigen, and then you've got the hepatitis B core antigen. And when we're testing for hepatitis B, these are the things that we test for. What happens is the supervirus hepatitis, we'll call it the supervirus, the surface antigen is a supervirus. And what it does is when it attaches to the liver, it then gets its house girl. We'll call the core antigen the house girl. It gets its house girl to do all the jobs. And basically the house girl starts replicating the DNA and causing problems for the body. Now, when the body goes to fight it, we need a lot of soldiers to go and fight this virus. But the smart thing about the hepatitis is it can lie dormant for ages. And literally it can stay in the body for a very, very long time and not be detected at all. And it can also be there and it won't give you any symptoms. And so I don't know, actually, Kujo, you might be right. I don't know exactly what I'm saying, but I'm just saying I like the virus because it's very, very smart. And the way it acts, whenever I read about it, I get an animation in my head of everything that's going on. But essentially, when you've got active hepatitis B, your surface antigen will be detectable. When you don't have active hepatitis B, your core antigen is what your surface antigen will not be detectable. But there are different stages of how you detect it. So yeah, and it can once you've got it, it is in the body forever. So essentially, it never goes away. But you just need to be a bit more careful because, as I say, it can always come back to life if you're immunocompromised and things like that. So yeah, it's just one to look out for. It's if you ask me, it's probably my favorite virus. But
I think the common cold should be your favorite virus. Maybe.
Why should it be my favorite virus? It's so boring. It's so common.
Yeah, and less, problematic. No, okay, fine.
No, but I actually want to say,
I was gonna say, don't most viruses? I can't say. I don't know what viruses, but most viruses lay dormant anyway, and literally hepatitis does.
They do, but I think I almost played a video for you today about the hepatitis B virus and how it works, and I think if you see it from like the way that it's taught to us, and I can't go into the details, but it's just the way that it acts. So, for example, the surface antigen is like the supervillain who then orders the core antigen to do its dirty work in the villain factory. This is literally how and then the villain factory produces like the hepatitis DNA, which then is spread around the body and causes problems. And then what our body does is initially we deploy the IgM, which is the first line antibodies. So that's the immunoglobulin M, which goes to fight off the core antigen. But as the IgM is fighting the core antigen, the surface antigen is still on the surface, producing more core antigens. And so even though we're fighting the core antigen, it's almost like cost 90 because the real villain, which is the surface antigen, is still attached. And no matter how many core antigen you kill, the surface antigen is just producing more. So even though our body thinks it's fighting a battle, it's actually not doing anything because it's not killing the real virus. So by the time our body realizes that actually I've been fighting the wrong enemy, I need to deploy IgG to go and fight the surface antigen. By that time, sometimes it's too late. But then that happens anyway, and the IgG goes to fight the surface antigen. And then what happens is when it's fighting the surface antigen, none of them are detectable because they're so low. So you can't, when you take a blood test, you cannot detect the surface antigen. You cannot also detect the IgG because they're so low because they're fighting like a real bad battle. And then after 6 months' time, if you take the blood test again, one is going to come out. If you detect the IgG, it means that the body has won. If you don't detect the IgG and you detect the surface antigen, it means that the hepatitis virus has won. And that's usually after 6 months. So when you test your blood test again after 6 months after hepatitis B, if you have more surface antigen, it means that actually your body lost the battle, which means that the hepatitis B virus is now the one that's running the show. And basically, when it gets to that point, it's really difficult to get rid of it. And there's nothing you can do that can usually get it down. And that's why we usually advise people to get the vaccine for hepatitis B, because if you get the vaccine, it skips all the steps for the IgM, the initial battle, because it's like your body is first introduced to the vaccine. So it does the whole core antigen thing. And then when you are actually infected with the real hepatitis B, it goes straight for the surface antigen. So it skips that whole battle with the core antigen. It goes straight for the surface antigen.
You keep mentioning one type of hepatitis. Is this true for all hepatitis?
No, this is only for hepatitis B, and that's why I said hepatitis B is my favorite virus. Like out of all of them, it's just not that it's my favorite. It's probably the most dangerous one. It's my favorite one because I just think it's like the smartest virus. If you think about it, it's very interesting the way in which it works. But that's why I wanted to talk a bit more about that because the hepatitis B
is more dangerous than C.
Yes, because C is. Yeah, in my opinion, I know that they say that C is probably no. I think B. I think in the table that I showed, I think it says C. But the reason I say B as well because again, I didn't go into the details of this. But hepatitis B, if you have hepatitis B, you can also get hepatitis D. So you cannot get hepatitis D without ever being infected with hepatitis B. If that makes sense. So if somebody has a hepatitis D, has ever been infected with hepatitis D, that means they've been. So hepatitis D is a virus that it's a superimposed virus. You cannot get hepatitis D if you've never had hepatitis B. So sometimes you can get something called co-infection, where you get hepatitis B and hepatitis D infection at the same time. Or you can get something called a superimposed infection, where you first get hepatitis B, and because your body is fighting so hard and your immune system is down, then hepatitis D takes advantage of that, and then you get a superimposed infection of hepatitis D. So hepatitis B and D are almost like brothers. They tend to work together, and you cannot get hepatitis D if you've not had hepatitis B. And that's why I think that hepatitis B is probably the most dangerous one out of all the ones, just because there's so many things that can go on with it, and then you can get the secondary infection as well with hepatitis D on top of it. So that's why I would say it's probably the most dangerous of all.
Okay. Thank you so much, Dr. Akos. Any more sorry, Dr. Kujo, Dr. Kujo's time to shine is coming soon because Dr. Akos has to leave us. Thank you so much, Dr. Akos. Dr. Akos is at work, as you can see, and she dedicated about 30 odd minutes to have this talk with us. And so after the break, Dr. Kujo is going to take over with the Q&A session. So Dr. Kujo will answer.
I might stick around a little bit, but I'll be in the background. Dr. Kujo will do the Q&A.
Thank you.
Yes. So, but just Dr. Kujo, I know you are in a hurry to start your work, but before that, let us please go for a quick commercial break. And just to let you know, you can ask any and every question. It doesn't have to be about hepatitis. It can be any health question that you have. So see you soon.
Me did Yanteshua, and maybe I'm discovered for Europe. I bushing for Ghana. No, me used to tap send. No fee mobile money transfer. Easy, convenient, fast, and sounds so free. Me discover map tap send. NTN also download the tap send app. No, ever mobile phone so free. Na first kakomo bushing for Ghana for na tap send. Papa no.
Welcome to the epitome of luxury living, Whitewall Properties. We are a Ghanaian-owned real estate company that develops comfortable apartments and townhouses for residential and investment purposes. At Whitewall Properties, our vision is clear: to be Ghana's preferred real estate developer. We are driven by a passion to deliver consistent quality in our product and customer service. Our commitment to excellence is unwavering, and our team's dedication to providing an outstanding experience sets us apart. For over a decade, Whitewall has been at the forefront of Ghana's real estate industry, creating spaces that are not only comfortable, functional and located in the heart of Accra, but also stylish and luxurious. Each of our prestigious developments reflects our core values of quality, reliability and customer satisfaction. Choosing Whitewall Properties means choosing a partner who understands your needs and exceeds your expectations. We are proud to contribute to Ghana's real estate landscape, offering homes and investment opportunities that are second to none. We invite you to explore our projects and discover the Whitewall difference. Contact us today to learn more about our development and how we can help you find your perfect home. Visit whitewallproperties.com or call us. Whitewall Properties. Discover true comfort.
Hello, hello, and welcome back, everybody. Dr. Akos, for those that have maybe perhaps just joined, Dr. Akos just gave us a talk about the hepatitis virus. She ran through all 5, and she's had to go. She is in the background, but she's had to go off because she's working. So Dr. Kojo will be taking over from here. Dr. Kojo will be running the Q&A sessions, and as we do, you can ask. Dr. Akos is back, but she'll be off and on. So Dr. Kojo will be the main, but with support from Dr. Akos. You can ask any and every question. You can ask questions about hepatitis, which we talked about today, or any other health topic. And to kick it off, Dr. Kojo, we've got a question in the chat from Cecilia. Can you have hepatitis B and still get the vaccine? If yes, what will the vaccine be doing to the body system or protect you from?
Wait, hold on. I thought Dr. Akos said she was going to stick her. I don't know if she wants to, just stick.
Okay, well, both of you can take it.
I'll probably go in the next 10 minutes. So, okay, fine, I can take the first couple. Yeah, you can still have the vaccine after having the hepatitis B. The only thing is, it's mindful to know that obviously, just because you've had a vaccine doesn't mean that you're not going to get the infection. But what vaccines usually do is, because they introduce your body to the infection, so then your body builds antibodies against them. So in the instance that you actually do get the infection, then your body is like almost prepared. And this is what I was talking about with the hepatitis B. Instead of your body starting the fight right from the ground, because your body's already been introduced to the vaccine, it's almost had a mock exam, it's prepared for the virus. So when the real virus comes, it skips the whole core antigen thing, because it knows what I need to do is I need to go for the surface antigen. It just goes straight for the surface antigen. So it almost makes you more well equipped for it. Having said that, yes, if you've had the infection before, you can still have the vaccine. What that would do, I'm not entirely sure, but I know that literature says you can still have it. So, but I know that when you do have active hepatitis B, it's treated with the immunoglobulin. So that's again just supporting your body. When I said IgG and IgM, so IG just means immunoglobulin. So your body produces these natural immunoglobulins to fight against the hepatitis virus. So giving you sort of the immunoglobulins just helps your body in the fight against the virus. So that's probably going to be more effective than the vaccine.
Dr. Could you have anything to add?
No, I think like Dr. Akos mentioned, if you've already had the Hep B, the vaccine is not going to cure it. Like, that's what I know. Or it will help treat the infection per se. Vaccine, I don't know if when we like vaccines normally just works. It's effective for prevention when you have not like virus. So it normally doesn't really take like any effects like that. It won't eliminate it, but I think what it normally does is just helps with medical monitoring and possibly antiviral treatment. They have
I think from what I read, it was just saying if you are at risk of reinfection, then they may consider doing the vaccine. But again, I think it's a bit like I said before, like you said as well, I think it's probably counterproductive because you've already had the infection.
When you say at risk of reinfection, because I thought virus when you had
I knew, you know what, I knew you were going to ask that question.
I think you mentioned that if you have the virus, like it's not fully gone. That's what she mentioned, the surface antigen. Like the immune system is trying to fight it, it's thinking that it's eliminating it, but whatever you do is like it's still one way or the other, like still in the system. So it's normally not doing much. That's what you said.
And I mean, but even if you think about like the flu and stuff, we say once you've had the flu, you shouldn't be able to get it again. And same with chickenpox. Once you've had chickenpox, you shouldn't be able to get it again. And in most cases, that is true. But if you think about having a low immunity and low immune system, it just means that you're more susceptible to getting it again. So if you haven't got enough, if your immunity is low, you can get it again. You can be reinfected with it.
It's quite new information to me that if you have the flu, the cold or the flu, is it the flu or the cold you mentioned?
Flu.
Okay, flu is a bit different. But
so the cold is, again, it's all a virus, isn't it? So for example, if you've had flu A, so different types of flu. There's flu A, flu B, again, just like that. Hepatitis, you know that viruses are just smart. I like viruses. So if you've had like a flu A, you shouldn't get flu A again. You might get a flu, but it might be flu B or flu C or whatever, something else. But in some cases, you can't get the flu A. You can get it twice. And somebody in the chat just said they've had chickenpox 3 times. My goodness, sorry. That's wow. I've had twice, but 3 is a stretch. Yeah.
So okay. So,
Dr. Akos,
Felicia, yeah.
I've had it 3 times. I had it when I was a baby, and then whilst I was growing up, and then when I was 29, I was married, and then I had it again. Yeah.
Question. I thought when you have chickenpox a second time,
shingles. What full?
I thought it was shingles.
Not necessarily. You can get chickenpox. So most of the time, they say if you get a second chicken, it's shingles, but you can actually get that. I know you can get chickenpox at least twice. 3 times is the first I've heard.
I've got the mark to show you if you want to see the evidence.
And it definitely wasn't shingles.
I wanted to contribute to the hepatitis vaccination.
Yeah, we'll come back in a minute.
You can go ahead and contribute, please.
Yeah, so I just wanted to say that, like Dr. Akos has explained, so usually before they give you the vaccination, most often they will test your blood first, and it should have a certain level. It should be more than 100, something I will not add. And if it's low, they would, as has been explained, you need to protect your liver. You know, Dr. Akos has really stressed on it. So if it's below a certain level, then you have the vaccine to help protect your liver, you know, from damage in future and so on. So it's important that if your doctor or your GP or your workplace, like health workers, for instance, frontline health workers, if you are at risk, you cannot work in this country without getting the hepatitis vaccination. It is mandatory. And then they'll be checking your levels. So if you leave one work and you go into another place, when you go, they will check your levels to see whether you are okay. If you're okay, they will give you a booster. So the vaccination is important.
So do you get, as a frontline worker, do you get all 5 vaccinations?
Yes.
5 different ones, right?
Yes. No. Hepatitis B.
B and C, I think, is the main one.
Hepatitis B
and D.
If you are saying, can you get it? Meaning, can you be infected with it?
No, she's saying you can get the vaccine. I was like, I think.
No. It's just A and B.
No,
A and B.
Yeah.
A and B.
Even the A is not part of.
I've not had the A. I think it's the B.
D.
It's literally. So this is what I was talking about. Hepatitis is literally just the B. I've only had the B. I haven't had any others.
Yeah.
So does that mean that the B is like the more contagious one?
Yes, I've worked with doctors who got hepatitis B just from surgery, operating on other people and so on. So it's important.
And anti-comfort, this is what I was talking about before, and I say this is, remember when I was saying, I was like, A is the most common to get because you get that from basically just eating or touching stuff and but I said B is more prevalent and more dangerous because if you think about B, it's even though it's sexually transmitted, you can also get it through sharing bodily fluids. So it's like HIV. This was about HIV.
Yeah.
So if somebody's got a cold sore, you've got a cold sore, and you go and kiss them, and your blood, you're sharing the bodily fluids, the saliva is mixing, you can get it. If you've got a cut on your hand, and I talked about the needle stick injury. So for example, if you think about doing surgery, you've literally got your hand in somebody's body filled with blood. So if you've got a cut on your gloves, or you've got injury to your hand, then so this is what I was talking about. Even sharing toothbrush, and I think anti-comfort you put in the chat, sharing toothbrush, a lot of people feel like, about sharing toothbrush. You're mixing saliva, number one. If somebody's got bleeding gums, you've got bleeding gums, you don't know these things, sometimes we don't pay attention to them. But that's why I'm saying it's important that you're a bit more careful. Or be the towel, or you've used the towel, you've used it to rub your hand, you've got a bit of a cut on your hand, you don't know. I mean, it's very, very rare. It's very rare that you're going to get hepatitis B from sharing a towel with somebody, but it's not unheard of. You know, so you need to be a little bit careful, especially if you're living in a house, like in a student accommodation or in a house of other people that you don't know. You just need to be a little bit more careful.
Yeah, and also, sometimes people have sex while they are in their period. Remember, it's a lot of blood, and it depends. If you are free from infection, fine. But if you are not free from infection and you're in your period and you have hepatitis B, you can easily give it.
And that's usually the woman passing
the other way
on
around.
mostly.
Because of the presence of blood, you can also easily catch it from.
Absolutely, yeah.
Well, thank you guys. Dr. Akos just rebuked me as she she said that she talked about something and I didn't listen, so don't be like me. Auntie Liz, please.
Good evening, family. Welcome back, Dr. Kojo. And please, when you're talking, can you speak up? Some of us, we are a bit, and you've been very, I think you're far from your mic. Dr. Akos, no, Dr. Kojo.
Okay.
I'm sorry.
Dr. Akos, you are okay. And wow, happy Valentine's, belated Valentine. Yes. I had about 3 questions when you were talking, but hey, it's gone. Anyway, somebody is saying I should ask. They don't drink, apart from occasional glass of wine. But then they went to the GP and their test came like they should reduce their alcohol intake because of liver something or the other. So is it possible that even if you mentioned something about alcoholic liver, even if you don't drink, can you still suffer that kind of liver? Can you have that kind of liver? Well, I don't know how to put that one.
If it's been specifically mentioned that they've got alcoholic hepatitis, then, I always say it's interesting because if you say you don't drink, but you drink occasionally, fine. But how much are you drinking occasionally? Are you
No, Dr. Akos, they haven't got alcoholic hepatitis.
Okay.
It's just that their liver function was showing a bit higher.
Okay, okay, fine.
Yeah.
So yes, you can, and I did mention that there are other things that can give you sort of liver issues aside from virus, but we talked about sort of eating too much fat or, maybe having autoimmune. So sometimes your own body fights against your liver for no reason. So there are different causes of having hepatitis. But I guess the point I wanted to make about the drinking was sometimes we get people saying that, and I'm not saying this is the case for the person asking, but we get people saying things like, I only drink occasionally, but are you binge drinking occasionally? So for example, I would rather you drink a glass of wine every day, even though you're over the limit, but steadily, a glass every night, than you tell me, oh, doctor, I don't drink. I only drink once a week, or maybe I only drink once a month. But that once a month, you're drinking maybe 3 bottles of red wine, 5 bottles of white wine, and that's your occasional drinking. So we just be mindful of when we say we occasionally drink. It's not about how often you drink it, but it's about the quantity or the limits that you're drinking. So binge drinking alcohol in one sitting can cause more problems than somebody who steadily drinks alcohol. So we need to be mindful of that as well.
Yeah, that's of course also to answer Auntie Liz's question. There are people who like taking herbal medication. And the liver, every medication goes through our liver. And therefore, if you are taking herbal, all sorts, bitters, all sorts, all the time, you are putting extra work on the liver. And that can also cause liver problems.
Just before I go, I've got 3 minutes. I want to touch on what you said, Auntie Comfort. So thank you so much for bringing it up, because I remember last week I talked about this, but during the week I actually heard a story of apparently a company in Ghana that was selling herbal remedy, and they were saying that the herbal remedy was very good for pain. So itiare, like oyemia, everything, it was very good for pain. And apparently what the drug, what is it called, FCDO, the drug authority in Ghana, what they found out when they did a bit of research was that they went to the factory of this herbal herbal factory and found that what they were doing was they were crushing paracetamol, mixing it in FDA, thank you. Crushing Food and Drug Authority, yeah. Crushing paracetamol, mixing it in water, adding a bit of honey and sugar to make it sweet, and then repackaging it. So they were doing that and selling it as, oh, it helps with pain. And then, truth be told, if you've got pain in your head and you take paracetamol, of course, it'll make the pain go away. So people were taking this thinking, oh, this really works. But the downside to that is paracetamol is very toxic to your liver. And that's why we say you shouldn't take more than 4 tablets of 4 courses of paracetamol a day to 2 tablets at once. If you're less than 50 kg, 1 tablet, 4 times a day, 6 hours apart. Because paracetamol is very, very, very toxic to the liver. So imagine this herbal medication that you are thinking you're drinking some leaves, but in effect, you're actually drinking paracetamol, and you're actually, in effect, having a paracetamol overdose. I treated a lady last week who had paracetamol overdose to the point where we have to put her on a liver transplant because the paracetamol, she had 40 paracetamols at one go. She was mental health suicidal. And I think I mentioned this last week, we had to put her on a transplant list because she damaged her liver. So if you're drinking herbal medication, thinking it's herbal medication, but actually you're drinking paracetamol overdose, you're going to end up needing a liver transplant. So we need to be careful.
Dr. Akos, before you go, I've remembered some of my questions. So you said all the ABC, whatever. Which one is deadly and which one? I heard something like some of them you don't get them forever. They come and within some months they go, but some stay with you. And also, why from B to D? You jump the C. What's happening there?
I think some of these things, the way that they name it is just which one they find first. So I think they probably found the A first, and they found the B, the C, the D. And then eventually when they found the D, they realized that the D was the sister of the B. So I think that's what happened. But essentially I'm trying to share my screen just to show you the table again. So in this table, it says that the B is the second most common. And then I think it had prognosis somewhere. Where's the prognosis? It doesn't say it here. But I was saying to the B, you have the A, B, C, D, E, and you have G apparently. The B is the second most common. The A is most common. But if you look at where it says chronicity, A is not chronic. So for A, you're very unlikely to get A for a long time. A lot of the time when you get A, it only sticks around for 6 months, for the majority 6 months, and then it goes. But the rest, you can have them chronically. So you can have them lasting longer in the body for a long time. I'm trying to look for where it says prognosis, because I think B, as I said before, for me, B is the most dangerous. I think that's what you asked, Auntie Liz. Did you ask which one's most dangerous?
Yes, I think I did.
Yeah, I think, again, for me, I think it's B that's the most dangerous, just because of the way it's very common. So that means a lot of people have it. And then it's quite easily spread, especially if you're sharing or being intimate with somebody, then it's so yeah. And also it has a risk of liver, there's a risk of getting liver cancer if you have B for a long time. So if you have active hepatitis B infection, then you have a high risk of getting something called HCC, is a liver cancer. But yeah, so for that reason alone, I think that it makes it a little bit more dangerous than the others.
What about the C? Did you say anything about the C? I don't remember.
I said the C is very similar to the B. The only difference there is that it's not very as common as the B. And a lot of the time, people who get the C is very common in people who do drugs. So okay. C is very common for people who share needles, like needle stick injuries and things like that. So it's very common for people who do drugs. So for that reason, it's not very common but it's actually very similar to the B. So after the B is the C that I will be more worried about.
Thank you very much, Doctor.
No problem.
Thank you, Auntie Liz, as always. Auntie Amma.
I'm gonna go now because it's 9:02 and I've
Dr.
been.
Coast, me patrol call.
Oh wait, Dr. Kojo will hold
Dr. Kojo will take over.
He's
He's
taking
still a
over.
doctor.
Oh, Dr. Kojo is
Yeah.
okay.
Still a doctor here. Don't
Oh,
worry.
Dr. Kojo. Oh,
Dr.
happy
Kojo
Valentine's.
Auntie, I'm happy to meet Dr. Abna Nebe you and one and Dr. Kwejo wa Hawaii. Don't worry.
All right. So guys, take care. Thank you so much.
Take care. Thank you, Dr.
Thank you,
Remember,
Dr. Coach. Have a good evening.
Remember to sing.
Good.
Thank you. Remember to sing happy birthday. Remember to sing happy birthday for Dr. Kojo because it's his birthday on Friday. So don't let him escape.
Happy birthday in advance.
All right, guys, take care.
That's why you're being cool and calculated.
Dr. Coast, I will forward it to you, yeah.
Sure, no problem. Okay. Thank you. Bye-bye.
All right, okay.
Tap send. Oh, it was my baby, you're from California. The only boss. Wait, one is baby, I will be everywhere a day and everywhere they go. TAPTAP send got me covered. It was therefore if you need to send money or transfer money from Europe, from Canada, from USA, from UK, any part in Europe, you can send it through TAPTAP send. And guess what? Oceania, they will receive it right here in Ghana and many countries across Africa. So what are you waiting for? Download TAPTAP send now on Google Play Store or App Store. When you download, it's so easy to use. Tell your families, tell your loved ones to download TAPTAP send. Okay? But also, when I receive my money, that's how the world is chilling. Like my view, hey, you crazy.
Thank you, Dr. Kwejo's mother, for trying on the 28th. Other than that, Dr. Kwejo would have had every 4 years one birthday. So we give thanks to Mama Kwejo, as the Nigerians will say. God bless her.
Amen.
I hope your mom is listening because this is amazing. And if she's not, you have to show her. But yeah, Chiama, please.
Okay. I wanted to say something about what Dr. Coase was just talking about the herbal medications now people tend to take. I remember during the COVID time, I think it's a neem tree. Neem tree is very good, but people took it so much that I know quite a few people who came up with liver diseases. And it's really on the increase because they don't have when we need dosage, they just take it. And Osha, a lot of people in Ghana, I mean, I know quite a few people who have got kidney problems and then liver diseases. And when you go into detail, find out what they've been doing. They've been taking one herb or the other. And I think it's time, and I don't know how we're going to just educate people back home. Herbal medicine is good, but the dosage is a problem in Ghana. Yesterday, someone sent me, my cousin in US sent me a video on a documentary BBC went to do in India. And there's this medication. It's I think it's tramadol, but they've changed it.
Tapentadol.
Thank you. And apparently, we're far. And my one yet to say, I think I don't know if I should say hallucinate or what should I relax on muscles. No? And apparently, the young ones are going for it. And the man said something which really stuck with me. I was just like, Father, help us. Or say, it's got very serious health side effect when people take it. And then the person was asking, say, why is it that when him say what this side effect now? So it's business. Until the people are doing anything for money. Until we need to educate our people back home And then even here, herbal medicine is good, but the point is, we have to do everything in moderation. And to know what our advice is. I don't know if Dr. Kojo and Dr. Kos will come on and then talk about drugs, and then even there are some medication when you are on. There are certain how do you call it, herbs that you shouldn't take because there's this is a drug interaction. Dr. Kojo is
Come again.
Drug interactions.
Drug interaction.
Yes.
Drug interaction, yeah.
Yeah. There are certain things that we get far. It may affect. Interrupt with the medications we are taking.
Yep.
I don't know. Maybe one day you come up and then educate us more on that. But it's a very serious issue. I think we need to be serious about it because it's taking the lives of a lot of Ghanaians. And when this Indian man was talking, when we started with Ghana, and they only call it, I think, say Cote d'Ivoire, and then Nigeria. But Nigeria, I think the Nigerian government caught it so early. BBC documentary, I won't call you undercover. India, please, it's something that we need to throw more light and then educate people. Thank you.
Yeah, so I think basically when it comes to these drug interactions and then herbal medicine, you never know, just like Dr. Akos mentioned, you never know what you are being given. You can probably be taking an overdose of paracetamol, which is toxic to the liver. One thing you may never know is that when they mix some of these drugs, the organs are affected, and every organ has a role to play. And as much as the liver has a role to play, the kidneys also has a role to play. So if we take these two main organs, you might probably be taking an overdose for one of the organs, which is going to cause complications. That is the reason why you never know what is being put in these herbal medication, because they don't give you the ingredients. They just probably say those selling it don't even have like knowledge about it. But when it comes to some of these drugs, pharmaceutical drugs, that is the reason why they give you the dose, the ingredient. They measure it, and how they go about it, it is being listed there just for legal purposes, so you get to know what you are actually consuming. Even with that, people don't have the knowledge about it. So maybe, yes, I know someone has been on the show to talk about drugs before. I'm not too sure about that, but probably maybe I don't know, Dr. Akos might probably talk to him so that he comes back, so people get a better understanding, because you don't just take medication just because you are not well, and then probably you are treating something and it's not working, you resort to herbal medication. I think our African community really does that a lot. You go to this hospital and they tell you that it is not working, try this, do this and do that, try this herbal, it worked for me. Probably it didn't work. Probably the person has a strong immunity and is not really taking effect, but you might probably go and take it and then something will happen to you. So let's try as much as possible to be careful with some of these things that we take in.
Yeah, and Dr. Kojo, I would just add that sometimes we are given medication and you're supposed to take it specifically for X number of days.
Yeah.
And some people would take more and even go and buy and say, well, the medication was too good. Anytime they feel those symptoms, they go and buy. The antibiotics we buy. Now people go to Ghana, and because it's easy to buy there, they bring a lot of antibiotics and they are taking it all the time. So watch out, your liver and your kidney will be affected. I also just quickly want to add that in regards to hepatitis A, personal hygiene, as Dr. Akos said, is very important. So personal hygiene, remember during COVID time, everybody was washing their hands. Even in Ghana, according to the information I received, during COVID time, nobody got cholera or diarrheal diseases during that period because everybody was washing their hands. And then soon after it went down, look at what is happening. So it's important for us to wash our hands before we eat, even if you have to throw granules into your mouth. The one cooking the food herself can go to the toilet, not wash their hands, and come and prepare the food for you to eat. And that's why, with hepatitis A, everything goes through your mouth. contaminated water, contaminated food, not washing your hands. So personal hygiene, I just wanted to stress on that. Also, if you are going to Ghana and you tell your GP, he may prescribe you hepatitis A vaccination. You take it and then you repeat the second one 6 months after, and that is for life. You don't have to have it again. So if you're you tell your doctor and he says they have the list of countries with issues. So if they put you on vaccination, just go for it, for your own safety. But remember that even if you're having the vaccination, you're supposed to practice good personal hygiene. Wash your hands. Washing of hands, very, very important. Hand hygiene. Don't ever leave it. Continue to do it. And if you use alcohol gel, remember, alcohol gel, yes, the germs are dead, but they are still on your hands. So if you have to eat, even if you've used alcohol gel and you have to eat or prepare food, you have to wash your hands with soap and water. The golden thing is soap and water. But if for some reason it's not easily available and you use alcohol gel, before you eat or prepare food, wash your hands with soap and water. It is also said that if you use alcohol gel for about 5 times, remember that. And sometimes you feel it in your hand that, you've used alcohol gel, but it feels, sticky, or it feels, something. You need to wash your hands with soap and water. That is the golden thing. I just wanted to, stress on that.
Great. Thank you very much. I think you mentioned the antibiotics. A lot of people who abuse antibiotics, what you don't know, you are causing more harm than good to yourself, because it's going to get to a time where you might probably have a bacterial infection, and then we will
resistance
any antibacterial in this world, and it's not going to work. So would actually be harming yourself. And secondly, personal hygiene. I'm very big on personal hygiene. When you come home, you wash your hands. You said soap with water.
Yeah, but now are you listening?
I lived through it too, so I know.
Not just water, but running water, wash your hands, keep your personal hygiene. Like, pick up that COVID personal hygiene, what's it called, attitude that we had, carry it along, run along with it. Make sure in your hands, like in your household, make sure you instill that discipline in the house. That is very, very important, because most of these infections that we get is due to poor personal hygiene. So please, let's try as much as possible to up our game in personal hygiene.
Auntie Comfort answered my question earlier, because I was going to say, what if you are in Ghana, you're on the road and you are hungry, and Kokwaya Tutubi is on the roadside and you want to eat, and obviously you can't wash your hands there and then with soap. So like, I was going to ask if way was good enough.
Yeah, use alcohol gel. Definitely use it, and use it very well. And remember, alcohol gel dries up very quickly. So if you put it in one hand, use your fingertips to inside it as if you are stirring something. Put it in, pour some in the other hand, and use your fingertips to also move it around. Before it's not like water which is fluid and flowing all the time. This one dries up quickly. So just make sure your fingertips are really soaked and, both before you rub them together. Yeah, you can still, using alcohol gel, but the golden thing is to use soap and water. So use alcohol gel if, before you eat your roadside plantain and corn and so on. Yeah.
Okay, thank you.
Abena.
Yes.
Kokwaya tutu abontin Ghana.
That's what it should be okay.
I mean,
and Auntie Comfort, you promise us the egg, Carlin, egg something, please. Yes.
Oh, so I found a spelling. It's Dr. Kojo. It's or if Abena can Google, it's CHOLINE. Apparently, it's something in eggs, not only in eggs, in a lot of food, which helps with our brain. Choline, CHO.
The nutrient.
Yes.
Okay.
It's a substance which can be found in eggs, and is good for brain development and
nervous system.
Yeah, and so on. Yeah, it's very good. So there are a lot of information out there that unless for some reason you've been restricted, we should not restrict ourselves. Eating 2 eggs. Boiled eggs is what is boiled and poached. Boiled and poached eggs are what they are recommending. If you fry it, you reduce the
choline.
The choline and other things. So the best thing is to poach it or boil it, but don't overcook it. Then you also don't have any benefit.
So the way we cook our egg in Ghana with the yolk fully boiled.
Even here. So when you boil your egg, you are supposed, as soon as it starts boiling, you are supposed to count. It should boil for just about 8 to 10 minutes. It will be cooked without being overboiled. As soon as you see the black ring, it's overboiled. If you see there's a dark ring around the egg is overboiled. You are not getting much from it. So we should not undercook it and we should not overcook it.
Very interesting.
Hey, kusi koda Psalm 120.
Yeah. Yeah, I think you're going to say something to Auntie Liz's point of Amber's point of the
cocoa. The way I am, right, when it comes to personal hygiene, I think I have OCDs. It's very strong, but I normally don't show it because think about it. They are going to sell the cocoa in a graphic. The graphic, you don't know
So if you carry your own graphic or if you carry your own...
That is the whole point because before, it's not as if we all don't eat it, we do it, but you don't know where they've kept. Do you know what? So color
Hey, please, it's okay. Let's stop talking about it. Please.
So, I mean, when it comes to some of these things, like it's a big deal.
So can I ask a question? Because when I
get typhoid and so on from
because the next time I go to Ghana, I cannot not have Kiliwili and gizzard.
Take your own container.
Take your own bowl and
ask them
your own plate.
Also, some of them are using, the roasted bowl. Some of them are using tongs. Sometimes you see some people using, some people they are using tongs instead of using their hands to turn it.
Yeah. Sometimes
you see people using tongs. So go with your container. Have some items, must have items in your bag, for things like that. Or maybe you've seen Agbilika Klo. Like last time there's a lady who does very nice Agbilika Klo, around Agbogbo area. So, and there's a queue on Sundays after church. People queue with their cars to go and buy. We went with our container and bought some.
Just point at the cocoa that you want. Tell the lady, please don't turn this one, and I'll pick it myself and put it in your own bowl. Simple. No hand, no touch.
I don't think they will allow you to do that. It's not as
practical as that.
Yeah.
They will, because I did when I went to Ghana.
I just came from Ghana and I didn't eat out.
Oh, welcome, Mama.
Thank you. I didn't eat out because I was so scared.
Yeah.
But
and I'm
going to Ghana.
Real bad one.
Hey, but that's the reason why I'm going, because I can't find the food. I can't get the food here, so I'm going.
No, you can.
It's not the same. There's something about there's something about that.
Don't let us spoil it. Like quen, you can never cook your own quen, and there's some special. Let's stop talking about it.
No, but I do understand the risks of. My mom also doesn't like outside eating, so I think striking a good balance, I guess.
Yes,
is the way forward. Just to finish off, there's a question in the chat. So I heard there's a bacteria inside the yolk. So if not boiled well, you eat it, it's harmful.
Yeah. So it must not be undercooked and it must not be overcooked. So that's the thing. But you know that here in this country, there are some people, especially the white people, they just break an egg and put it in their mouth.
Yes.
Sometimes you see that there are certain diseases we don't get because we overcook our food, and they get it all the time. So don't underboil your egg, but don't also overcook it. So there's no point.
Yeah, I think it's salmonella, which is
salmonella.
Food poisoning. So anyway,
and just make sure you've washed it. I will wash my eggs before I cook it or crack them. I'll wash them, and when I finish, I'll wash my hands with soap and water.
Well done. That's a good yeah.
That's the question. What happens if you overcook? I guess you overcook it. Oh, okay.
Oh, you don't get there are nutrients in the eggs. So if you overcook any food, you lose most of the nutrients. So what's the point? You are feeding your body, but you are not getting the benefits.
For some funny reasons, the vegetables that we fry. Before, the way vegetables come by, sometimes, when you go and they go like, they are doing this indomie and they put it in the oil, they will be stirring it here, and before you're done, there's nothing, you don't get anything from it.
There's no nutritional value.
So don't overcook, don't undercook. There are some vegetables you cannot eat them raw. Yeah. It's also harmful. You need to cook them, but it has to be, there has to be a balance. Don't overcook it. And don't,
so, for example, like the contomere that we eat.
Yes, most of it is overcooked.
You still have to hear the grill. That is like when you cook it, so that way it's not overcooked.
Otherwise, there's no point. You are eating.
But contomere, if you eat grill, you will have your throat itching. It should be cooked.
Okay, so that one it should be fully cooked.
Yes, not overcooked, but
it should be cooked.
Okay.
Yes, I think we can parboil it.
Yeah.
Or steam it. That's the best way.
Steaming is the best.
Parboil and steam it.
All right. I don't know. I think is it time, Abna?
Oh, it has been time. But so, Dr. Akojo, you can give us closing remarks.
Yeah. Before we do that, can we sing happy birthday?
No, after his closing remarks, we'll sing the happy birthday.
Because if we don't, Jonas will meet us one day and say Jonas's birthday was the 20th. And Dr. Kojo will be 28. So now brothers in crime. Sorry, Doctor.
Abna is also next week, Monday, on the 3rd March.
Hey!
What day? What day?
3rd March.
So we'll celebrate on that Wednesday. No, we'll celebrate on that Wednesday.
Hey.
Oh.
Dr. Abna, you are
the same star?
Hey,
yeah,
wonderful. Wonderful.
The same star.
Yeah, we are.
Yeah, because it's very close. Wow.
Yeah.
Why? When is Sister Comfort?
Huh?
No, she's saying Kojo and I, we're 4 days apart. So that.
Yes.
So they share the same star.
Like that.
Well,
anyway, hepatitis, today was a good session. I hope we learned one or two. Just know that hepatitis is just an inflammation of the liver, which is caused by different viruses. We've spoken about the A, B, C, D, and E being the main types. We've said it can be transmitted through contaminated food, water, blood, body fluids. Vaccination, I'll hit on vaccination. It's available for Hep A, B, and it's a very critical tool for preventing these infections. Prevention is always key. Why hepatitis is very important in our community. Hepatitis is it's silent. Just like Dr. Akosua mentioned, she mentioned that it's like soldiers or something of that sort. You know how soldiers, they go for combat battling, they are very silent when they are attacking. And you might never know until it's too late. You wouldn't want to get chronic liver disease or cirrhosis or liver cancer, because I've seen many patients have liver cirrhosis and it's heartbreaking. I can't imagine what pain they go through and all that, basically liver transplant and all that, but it's very difficult. Imagine you can't even afford. So take a message from me will be prevention is better than cure. Make sure you take your vaccinations. Regular screening is very important, and adopt safe practices like we've said. Good hygiene, clean water, avoid risky behaviors such as sharing needles and unprotected sex. I've always said that before you start a relationship, make sure you screen your partner. That's the most important thing, not the money wise or what the person can actually get you or provide for you, but just get to know the person is safe and clean, because relationships do break. And what if it breaks and then you carry something home? It wouldn't be a good thing. So try as much as possible to pay attention to those things. Early treatment is very important. So if you have it already, don't be shy of it. That's the reason why the medical practitioners are around. So do well to talk to your GPs, talk to your doctors, talk to someone about it, and make sure you get the necessary help that is needed. One day we might also talk about alcoholic liver disease, which is also very important. Those who take alcohol, they also have their own thing that they go through. And we have autoimmune too, which is also another one. So we might try as much as possible to cover these things that will be done. Thank you very much for joining us and stay informed.
Thank you, Dr. Kojo. And now for the part that we have all been waiting for, is to celebrate or wish Kojo, Dr. Kojo a happy birthday, because it is his birthday on Friday.
So who has got the nicest voice? Otherwise, we will recite
you, Sister Lynn.
Okay, so we're just going to break it.
Happy birthday to you. I'm singing it the Ghanaian way.
Just know that
guys.
Music doesn't go too well because everybody's sound is different.
Happy birthday. Happy birthday. Happy birthday to Dr. Kojo.
May God
bless you now.
May God bless you now. May God
bless you now. May God
bless you, Dr. Kojo.
Amen.
Hip, hip, hip.
Hooray! Before we go, I know Dr. Kojo has summarized, but quickly, the one who mentioned salmonella, salmonella is the one who gives a typhoid fever, typhoid. So, as Dr. Kojo summarized, hand washing. So it's on the egg. It's in feces. So the egg came from from the bottom, from the chicken. It sort of pushed it out. So if the chicken has got it, it's on the egg. So it's important that you just wash your hands very well. Make sure you wash the egg, and also make sure the food is cooked but not overcooked.
Before we go, Auntie Comfort,
yes.
When you cook the egg, like you've got a egg boiler or something, wouldn't the heat cooking it kill whatever is on it?
Yeah, it should kill it, and that is why it shouldn't be undercooked. Yeah, it should kill it.
Okay.
So if you want
washing it before cooking is what I'm asking.
Yeah, you are just reducing infection. You are just reducing if it's there. It may not even be there because it's not in every chicken, but you are not sure. So, and remember, you've touched it. So I will wash it and then also wash my hand because
because I'm thinking the hand I'm using to wash it instead of just.
But you are using the hand to pick the egg, unless you are using something else to pick the egg.
Okay, we get it. Yeah.
Okay.
Now we wash it before we cook it to double kill it.
Okay. And it means before we go, Dr. Kojo, this question there, ubit me answer next week when you come. With regards to the screening during relationship, at what stage? Don't answer it today. From next week.
Are you going to get married? Let's know so that we find our.
Me person me who the practicality at what stage in the next week. Don't answer it today. Why, Bacho?
I'll do that next week.
Dr. Kojo, will you be with us next week? Because Dr. Kojo.
Nana, if you don't mind, can I quickly mention my thing?
Yes, please.
So, guys, everyone, I'm doing. I support women to breastfeed, and I have a program. And so if you know anyone who, especially second-time mothers who are pregnant for the second time, they wanted to do exclusive breastfeeding or feed their babies, but there were difficulties. And the second time round, they will need help, support. So while they are pregnant, that is where they need support, especially the last part of the pregnancy. They have flat nipples, they have all sorts. And so they find it difficult to breastfeed their babies. They want to do exclusive breastfeeding, but it's difficult. So if you know of any such person, if you let me know, I'll support the person.
Auntie Comfort,
yes.
Please, which area?
Which area? In what way?
No, which area are you based?
Oh, it's online.
It's a virtual thing.
It's a virtual thing.
Yeah, it's virtual.
Well done.
I can talk to the person and yeah.
Okay. Are you doing your LC?
Am I doing what?
Are you doing your LC exams or training?
No, do you want to? Because they will not understand what they are saying. So let's talk after this. Yeah.
Yeah. Have you got my
Because I'm trained already. I'm trained. Yeah. So
are you a lactation consultant?
Yeah, I'm a lactation counselor for the World Health Organization. Yeah.
Okay. All right. I'm a lactation consultant.
Okay. So let's talk, okay?
Noted. Thank you, Auntie Comfort. Thank you, everyone.
Okay.
So Dr. Kojo will get back to you about your question. We'll just have to. I'm not sure. Dr. Kojo, will you be here next week? If not,
hopefully.
Okay. All right. Just to close off. So tomorrow,
so, Nana, Amma, if you don't mind, if you give your number to Nana or take my number from Nana, then you can get in touch with me.
Nana has got my number.
Yes.
Nana, would you any Ghana?
Nana, actually.
What I can't say, bra, we move.
I'll bend day.
Nancy
is also very hot in Ghana. I hear very hot.
Yeah, I think I prefer that heat.
Me pamcho mama misa Nana Kwame one question. Fly to cry what they call no discount one share near in Kobe. And now what I know Jinaha or two.
What frame were today?
If you have a discount,
what's a main friend? Which I've been out trained. I'm a economy.
Okay, that's it. No problem.
Okay.
Thank you guys so much. Don't forget tomorrow, same time, 8 p.m. a time with TAPTAP Send, and on Friday, Ask the Lawyer. So we'll see you here same time next week. Have a good night, everyone, and thank you so much for your support.
Thank you. Happy birthday in advance, both of you.
Thank you.
Happy birthday. Yeah, we'll sing her on Wednesday. Today, just for Dr. Kojo, we'll sing her on Wednesday.
Happy birthday, Kojo.
Happy birthday. Happy birthday, Kojo. Happy birthday. Happy birthday, Kojo. Happy birthday. Happy birthday, Kojo. My dog says to you, Kojo. My dog says, Kojo, birthday, Kojo. Happy B-Day, Kojo.
That's lovely. Who did it?
Kojo.
Very nice.
Yeah.
Oh wow.
Well done.
That's coming from our producer.
Good night. Thank you.
Good night. Thank you, everyone.
Good night. God bless.